All right. Good morning, committee. It's a lovely Friday early morning. Welcome to all of you, and welcome to members of the public and those that are joining us online. Good morning. Mr. Caldwell, if you would call the roll.
Representative Clouston.
Here.
Representative Guggenmoss.
Here.
Representative Heft. Representative McCann. Representative McCann. Representative Ottman. Representative Stivar. Representative Wasserberger. Representative Yen.
Here.
Chairman
Rodriguez-Williams. We have a quorum.
Thank you, Mr. Caldwell. So we'll call the meeting to order, and I will first go over just a couple of meeting rules regarding decorum, and there's a list of these out front of the meeting room if you'd like to read them yourself, but this applies to those that are joining us online as well. Committee members and members of the public, please keep your cell phones on silent. Although it may seem an awkward formality, speakers will address their comments and questions to the chairman, not to individual committee members or to others in attendance. This helps us avoid personalities and comments of a personal nature. Comments will be directed to the issue under discussion by the committee. Distracting comments on unrelated side issues are out of order. Speakers will avoid personal criticism, ridicule, or name-calling directed at anyone else in attendance at the meeting. This includes comments of a personal nature directed at other speakers, audience members, or members of the committee. For audience members, we expect you will refrain from any behavior that disrupts the orderly conduct of the meeting. Specifically, the rules prohibit speaking out when another person's talking, carrying on loud and distracting side conversations, and any shouting, clapping, or booing in response to speakers' comments. Our guidelines are simple. We just ask that everyone conducts themselves in a civil and respectful manner at all times during the meeting. Today, we have 3 bills on the agenda. Not sure if we'll get to them all, but we've got them all on the agenda here. We have House Bill 250 that we will continue from our last meeting. We left off with in-person public comment, and we'll move on to Zoom public comment. After that bill, we'll hear House Bill 289 titled Certificate of Need Repeal. And then if the committee still has time, we'll hear House Bill 128 Public Health Emergencies Definitions Amendments. So House Bill 250 is back on the table, committee. Mr. Caldwell, if we have anybody online that would like to testify, please allow them in. Okay. Good morning, Ms. Shaver. Welcome. Hope you can hear us. Please state your name for everybody for the record, and we'll hear your testimony. Ms. Shaver, your audio isn't coming across very well. Let's try it again. Yep, you're muted.
Marcy Shaver, resident of Goshen County. I'm also the state director for the Wyoming State Director for American Atheists. I'm representing them and atheists all across the state. We oppose this bill as an encroachment of religion into our laws. It's not a medical issue. This is a religious beliefs issue. And for that reason, it's to stay out of our laws. I'd also like to mention scientifically, it's not a sound idea either, because a zygote can have like 25% of its cells removed, and it won't affect the development at all. It can also be stuck in a freezer for up to 10 years, thawed out, and deposited in a uterus and it will still develop into a human being. I guarantee you that, Madam Chairman, neither you nor any member of your panel could survive either of those. Like, so that needs to go from a single cell to multi-trillions of cells in 9 months, and a lot can go wrong. It just, this needs to be a decision that is left to the people. Our suggestion is, since this what, the third or fourth bill so far on basically still trying to ban abortion, I suggest that the legislature next session pass an amendment to the Constitution banning it and put that for a vote before the people and see if Wyoming truly agrees with you guys. Thanks. I'm happy to take questions.
Thank you, Ms. Shaver. Committee, any questions for Ms. Shaver? Okay, seeing none, thank you for joining us this morning. Okay.
Can you hear me?
Yes, good morning, Ms. Pavey. Please state your name, who you're with, and we'll hear your succinct testimony.
Good morning, committee chair and members. My name is Laura Pavey, and I'm here representing myself today. I stand before you today with a heavy heart but unwavering resolve. Wyoming has always been a state that protects its most vulnerable. And HB 250, defining the life and the rights of every natural person, shows that Wyoming stands up for basic rights to life. Every single day in our nation, precious lives are ended before they have a chance to draw breath. These are not just statistics. They are the future artists, teachers, ranchers, innovators of Wyoming. These are the children who will never grace our schools with their presence, never experience our majesty of our mountains, never contribute to their unique gifts to our community. This bill recognizes what science and medicine have proven time and time again, that life is precious indicator begins remarkably early. When there is a heartbeat, when the organs are forming, when tiny fingers and tiny toes are taking shape, these are not just cells, these are children. HB 250 acknowledges these scientific realities by protecting any person showing signs of life through basic biological functions. As we invest millions of dollars into our education system, we must ask ourselves, who will fill the classrooms if we continue to permit the termination of innocent lives? Our school faces a decline in enrollment, and we've lost generations of Wyoming children who should be sitting in those desks today. To strengthen this vital legislation, legal action challenges, I respectfully suggest some following amendments. If on line 2, or page 2, line 18 through 21, if all individual persons are living human beings, being entitled to the protection of their health and life as guaranteed by Article 1, Section 2 of the Wyoming Constitution, establishing their inherent right to life as a fundamental and equal right for all members of the human race. This right is a fundamental right entitled to full protection under the Wyoming Constitution. And I thank you for allowing me to speak today.
Thank you, Ms. Pavey, for joining us this morning. Committee, any questions? Okay, seeing none, thank you again for joining us.
Thank you.
Do we have another? Okay.
Hello, am I supposed to be talking?
Yes, good morning.
Okay,
Welcome,
I'm
Ms.
sorry.
Lichtenfels. We can
Um,
hear you well. Just please state your name and we'll hear your testimony.
Sure. Thank you. My name's Christine Lichtenfels. I'm from Lander, also with Chelsea's Fund, and I'm an attorney. And today I speak in opposition to this bill While there are multiple reasons I oppose HB 250, not the least of which is the disregard for pregnant women's own health and well-being and the approval of governmental control of a woman's body within this bill. In fact, soon the government will be telling pregnant women what they can and cannot eat or drink and what they can or cannot do. I will limit my comments to 2 points. First, if the legislature wants to strip pregnant women of their rights to make decisions about their own health care and about their own actions, the mechanism, as well, this has just been suggested, would be to run a constitutional amendment. That would be the best way to do that. Second, the Wyoming Supreme Court will very soon determine whether the right to abortion is protected by the Wyoming Constitution. If they determine that the right is protected, then this bill is most certainly unconstitutional as an infringement on that right and will not be effective. However, if they determine abortion is not protected, then the legislature's previous 2 bans will become effective, and this bill will be unnecessary to ban abortion, which is the goal of this bill, as I understand it. But the additional barriers to effective and timely care under the bill will still be effective, and healthcare providers will still need to request an exception from the Board of Medicine, possibly, as a previous commentator noted, for vaccines, for common uses of medication, and much more, and give this governmental agency decision-making power above and beyond your own physician about the right course of treatment. This makes no sense. The Supreme Court is going to render a decision soon. The best course of action would be to wait for that and then take it from there. So I thank you for your consideration, and I ask you to vote no. And I'm happy to take any questions. Thank you.
Thank you, Ms. Lichtenfels. Any questions? Representative Yen.
Madam Chairman, thank you. Ms. Lichtenfels, thanks for joining us. I know a lot of folks in the legislature, when they passed the abortion ban that we put in place, felt more comfortable with it when we put those exceptions for rape and incest. Do you see that this bill would erase those exceptions?
Madam Chair, Representative Yin, yes, I don't see that there's that exception there at all in this bill.
Further questions from the committee? Okay, seeing none, thank you for joining us.
Thank you.
All right. I will close public comment on House Bill 250, sponsored by Representative Nyman, who's not, our Speaker Nyman, who's not with us this morning. Committee, what is your pleasure? The bill's been moved by Representative Gugemas, second by Vice Chairman Ottman. Discussion and amendments on House Bill 250. Representative Klauston.
Thank you, Madam Chair, and thank you, committee. I spent probably 4 hours in the last 2 days trying to improve this bill. I worked with LSO. I've got several pages of amendments. I spoke to the bringer of this bill on some issues maybe that he wasn't quite aware of. So I'm going to make a motion to table this indefinitely. I'd like to work on this some more. It's something I'm in favor of and I've spent a lot of time on. I just don't think this bill is ready to bring to the floor. I think we'd spend a lot of time working on it, and I don't think we have that time where this bill sits and what day we're at now. So happy to continue to work on this bill. I'm just going to make a motion to table it indefinitely and probably bring it back this summer.
Okay, committee, the bill has been moved, and now there is a motion to table it. So Representative Yin has seconded it. Any discussion on the amendment, on the motion to table? Representative Wasserberger.
still probably oppose abortion, but I think if we were to do things to make ourselves more successful long-term, that would just be a better approach to this, so there's a lot less tension on encouraging people to have children. So I'd be okay with tabling this for now.
Representative Gugamas.
Thank you, Madam Chair. I think, yeah, I support this bill and what its goal is, and I want to do it right. Also, time constraints are a factor here, and I think this would probably eat up a lot of valuable time since we're kind of in a crunch right now. So I would be in favor of tabling it.
Further discussion? Okay, I have a question for the bringer of the amendment, or the motion. Yeah, so, I guess personally, I would lean towards not and working the bill for the good speaker. Just curious, like, how many proposed amendments do you foresee? I mean, 4 hours of working a bill. I mean, I don't know if you're a slow reader or a fast reader or what that looks like. But if you could elaborate more for me.
Thank you, Madam Chair, and thank you to the committee. I have about 2 pages of amendments, putting in definitions that I worked with LSO, so it's conforming language to existing statutes that we already have. So there's quite a few subjects in there, and I'd be happy to bring those to the floor, and I could continue working it, but it'll make it a much better bill, but there's still parts of it I couldn't fix. There's still part of it that makes, like, circumcisions in this bill are illegal. There's a lot of pediatric and neonatal care things that this bill does not address. So it's a much bigger bill than we first thought, and its repercussions on medical care of kids will really be affected by this bill. So it's going to take some time.
Okay, any further discussion or questions regarding the motion? Okay, Miss. Okay, I'm gonna, Mr. Caldwell, if you just call the roll on the motion to table House Bill 250.
Representative Klauston,
Aye.
Representative Guggenmoss,
Aye.
Representative Heft, Representative McCann, Representative Ottman,
No.
Representative Stivar, Representative Wasserberger, Representative Yen,
Aye.
Chairman Rodriguez Williams.
No.
Madam Chairman, for the motion, there are 4 aye and 5 no.
Sorry, let me repeat that. The motion to table the amendment or table the bill has failed. Committee, we will continue to work the bill and listen to any amendments that you might have for the bill. So this is the time. Representative Yen.
Yeah, Madam Chairman, I'm going to move on page 2, lines 14 and 15. On line 14, strike interpretation and then on line 15, strike the Wyoming Constitution and. So the sentence would read, for purposes of construction under all statutes of this state.
Okay, so Representative Yen's amendment, Mr. Caldwell, do you have that? Okay, all right. There's a motion to amend by Representative Yin. Is there a second? Okay, seeing no second, the Representative Yin's amendment has failed. Further amendments from the committee or discussion?
Madam Chairman.
Representative Yin.
Yeah, Madam Chairman, I mean, the reason that I even motioned for that amendment was because the bill, I mean, I understand what the bill's trying to do. It's trying to provide ammo in a court that abortion should be illegal based on our current statute by telling the court that the Constitution says that it, what is and isn't a person. The problem with that is that because we've jammed it in our Title VIII, I don't know if anyone has ever read Title VIII. Title VIII is basically the rules of how we govern all of our statutes. And so, I mean, as Representative Clouston said, this has very, very, very far-reaching effects. And that makes it a huge problem. So, I mean, even if you are anti-abortion, I don't understand why you could support this if you're saying that you couldn't get an amputation, you couldn't get circumcision, you couldn't get cancer treatment. I mean, all of that is affected by this bill, which it wouldn't have been in the abortion ban that we had passed. So I don't know which lawyer suggested this to Representative Nyman, but frankly, I would suggest to them that it's an irresponsible bill.
Okay, further amendments, further discussion from the committee. Representative Clouston.
Thank you. I will save my pages of amendments, continue to work on this if this goes to the floor. I don't think I'm going to bring it all to this committee right now. Happy to share all the work I've done with everyone before. If we're going to hear it, I'll bring all of you everything I've done and worked with LSO. And LSO was great. They did a lot of work for me on this. So I'm not going to move the amendments now. I think I'll wait till the appropriate time.
Okay, thank you for your comments, Representative Clouston. Again, committee, I mean, this is what we do. We work bills during this time. So if there are further amendments from the committee, further discussion. Okay. Seeing none. There is already a motion on the floor, sensing the urge to vote. Mr. Caldwell, if you call the roll on House Bill 250.
This is a roll call vote for House Bill 250. Representative Clouston.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft. Representative McCann. Representative Ottman.
Aye.
Representative Stivar. Representative Wasserberger. Representative Yen.
No.
Chairman Rodriguez Williams. Madam Chairman, that is 7 aye, 1 no, and 1 excused.
Thank you, Mr. Caldwell. So committee, House Bill 250 has passed committee. I'll let the good speaker know that he will present that bill on the floor. House Bill 128 is now on the table. Excuse me, skipped one, sorry. House Bill 289, Certificate of Need Repeal, is now on the table. This bill is sponsored by Representative Geringer. Welcome, Mr. Geringer. Good morning.
Good morning, Madam Chairman.
Please present your bill to the committee.
Well, thank you. As you mentioned, my name is Rob Geringer. I'm representative for House District 42, which is Southwest Laramie County. So this is an easy, I think, little repealer bill that walks back the Certificate of Need requirements. For a little history, Certificate of Need laws were first implemented in the U.S. in the 1960s as a way to control healthcare costs and ensure the equitable distribution of medical facilities. So the idea behind the laws was to prevent unnecessary duplication of healthcare services, which could lead to overinvestment in medical facilities and higher costs for patients. Congress passed an act in the 70s which mandated that all states establish CON programs as a condition for receiving federal funding for healthcare infrastructure. Wyoming responded and did so. However, in 1987, the federal government repealed its own CON requirements, recognizing that these laws had failed to control costs and instead stifled competition and limited access to care. Since then, many states have followed suit and rolled back their laws to allow healthcare providers to expand and innovate freely. So today, Wyoming remains one of the last states with a CON law restricting nursing home expansion. This bill addresses this issue by repealing these restrictions, which in turn allows for much needed growth in long-term care facilities while still ensuring safety standards are met. So this repeal will increase access to access to care by making it easier to expand facilities and add nursing home beds, encouraging competition to improve services and affordability. It reduces bureaucratic delays that prevent providers from responding quickly to community needs. And as Wyoming population ages, which we all know it is, we can adapt by ensuring that we have enough capacity to care for our seniors. This bill does not remove safety oversight. The Department of Health will still review facility alterations for health and safety compliance. It simply ensures that investment decisions are driven by patient needs, not outdated government restrictions. And additionally, by 2029, the Department of Health will report back on the effects of this repeal, ensuring that we track its impact on Wyoming's healthcare system. I guess I'd say this bill really allows us to join the majority of states that have already repealed the unnecessary barriers and allow Wyoming's long-term care industry to grow and better serve our citizens. Madam Chair, I can either walk through the bill and go through the specifics of it or leave it open to questions.
Representative Geringer, thank you. It's up to you. If you'd like to share more information on your bill, you're welcome to do so.
Sure. Okay, I will continue then. So as we look at the bill itself, obviously the first page is really just kind of the summary of it. Where we get into the meat of it is on page 2. We are adding in lines 8 through 11, information submitted pursuant to this subsection. So this section has to do with when the licensee comes in and contemplates the construction of the facility, they still need to submit to have these plans reviewed, but the information that is used is only to be used by the division for purposes of healthcare and life safety compliance, not in terms of determining the certificate of need. Then we've got the repealer section, lines 13 and 14, and I'll walk through those just briefly here. So with the repeal of 352901A, the construction area definition. So what it does currently is defines a construction area as a 30-mile radius from any existing nursing care facility or hospital with swing beds, limiting where new nursing homes can be built. Why we're replacing it is, or why we're repealing it is because it just kind of arbitrarily restricts the development of new facilities, even in areas where there's increasing demand for nursing care. So really, it just eliminates the definition as an unnecessary barrier to expansion and allows facilities to be built where they're really needed, not just where regulations allow. 352906B, the 85% occupancy rule, prohibits new nursing care facilities from being built if the average occupancy rate of existing nursing home beds in the area was 85% or lower, according to the annual report. So it again artificially limits the construction of new beds, even in areas where additional capacity may be needed. Occupancy rates alone don't reflect actual demand. So factors like population growth, aging trends, and access to specialized care should also really be considered. This gives communities the ability to expand services based on local needs rather than a statewide formula. 352-906C, 10% bed capacity increase limit. What it currently does is allows nursing homes and hospitals to increase their bed capacity by only 10% every 2 years, with a maximum increase of 10 beds per facility. Why we need to repeal it? Again, artificially restricts facility growth, making it difficult for providers to meet increasing patient needs, delays expansion projects, and repealing it really allows nursing homes to expand as needed without unnecessary bureaucratic hurdles. 352-906F, exclusion of adult foster care in alternative elder care homes. It prevents adult foster care homes and alternative elder care homes from being counted as part of the total nursing care facility beds when determining the regional capacity. So these facilities provide critical elder care services, yet were excluded from the calculations that determine nursing home availability. So this exclusion really distorted the true availability of long-term care services in Wyoming. Repealing this provision ensures that all forms of elder care are considered when evaluating the need for additional facilities. There's the repeal of 352-906G, which is the exemption for state-owned facilities. So this allowed state-owned and operated healthcare facilities to bypass restrictions in B and C, which is the 85% occupancy rule and the 10% increase cap, which creates an unfair playing field between public and private nursing care providers. So this exemption favors government-run facilities. If private facilities had to comply with the rules, state-owned facilities should not have been given a free pass, really. So this levels the playing field, allowing both public and private providers to expand based on demand rather than exemptions. So that's maybe a little more than a nutshell, but the summary of what we're doing here, and I'd stand for any questions.
Thank you, Representative Geringer. Committee, any questions for the bill sponsor? Representative Clouston.
Thank you, Madam Chair. Thank you, Representative, for being here this morning with us. Do you know of any examples where this certificate of need has stopped a nursing home from being constructed in Wyoming?
Representative Geringer.
Madam Chairman, to Representative Clouston, I don't have any off the top of my head here, but I will say that anytime we are propping up an industry with outdated rules that discourage more competition and the ability for expansion to occur, I'd say that if we can look at that and really kind of repeal the hurdles, I think we're in a better situation.
Further questions from the committee? Representative Wasserberger.
Thank you, Madam Chair. Thank you for sharing your bill today with us, Representative Geringer. Just out of curiosity, do you know what the occupancy rate of the nursing homes have to be in order to get we'll give you the go on some expansion for nursing homes?
Representative Geringer.
Madam Chair, Representative Wasserberger, thank you for the question. I'll look into that. I don't have that off the top of my head.
Additional questions from the committee for the bill sponsor? Representative Wasserberger.
Thank you, Madam Chair. This might be somewhat of a repeated question. Do you know anybody that's been affected here in Wyoming as like a family having a patient in a nursing home facility where maybe they would have had better care or it could have expanded, maybe the family could come visit their nursing home facility more often or things like that?
Representative Geringer.
Madam Chair, Representative Wasserberger, again, I don't have any of those examples, but I'll do a little digging and see if I can find something for you.
Further questions from the committee? Okay, seeing none, thank you for joining us. Are you going to stick around? Perfect, okay. We'll now open House Bill, I got it ready, 289, open to public comment. Are there any government agencies that would like to come forward? Good morning, Director. Welcome. You'd state your name for the record, and we'd love to hear your take on the bill.
Thank you, Madam Chairman, members of the committee, Stefan Johansson, Director for the Wyoming Department of Health. Representative Geringer really made my job easy this morning. A good overview and some history of the bill and certificate of need laws. I'll be brief, maybe answer a few questions that I heard, but also a little bit of background for the committee. Like we discussed in a few other bills, this statute that the legislature has on the books, we enforce and do compliance through our Office of Healthcare Licensing and Survey. And so the way that works is that a facility that wants to expand, or a facility that, or a company that wants to construct a new facility would make a request for that. We would look at the parameters of the statute, look at that 30-mile radius of not just that nursing home, but nursing homes within that 30-mile radius, and then ensure that that occupancy rate is either above or below 85% of all of those nursing home beds, and then adjudicate that decision on whether expansion or construction can happen. To answer a few of Representative Clouston's questions, give you about 15 years of data here. Since 2009, my office has received 18 requests for new construction. Based on the statute, 11 of those have been approved, 7 of them were denied. For expansion, there's been 2 requests. Both were approved for expansion, but only one facility did expand. That approval for the one that did expand was for an unlimited capacity because the nursing home bed occupancy in that region was over 85%. So Madam Chairman, really just here as a resource to the committee, and happy to answer any questions you might have.
Thank you, Director. Committee, any questions of Director Johansson? Representative Wasserberger.
Thank you, Madam Chair. Thank you for coming and sharing some of your information that you have provided with us today. Do you know if in rural area, so you said there was 18 requests, 11 were approved, and then the remaining were not approved. What was the reason for not approving the other ones?
Director Johansson.
Madam Chairman, thank you. Representative Wasserberger, we could certainly get a breakdown list of each facility, but in general, it's the approval or denial would be strictly based on what you see in the statute there. So in that 30-mile radius was occupancy above or below 85%, and then you get a little more nuanced with what the specific request for expansion might have been, because there's 2 elements. Expansion and new construction. On expansion, we would look at that 85% occupancy threshold in that geographic area. And then obviously there's some flexibility within the statute if the expansion was only for a maximum of 10 beds or 10% every 2 years. We would look at that as well, since that kind of adds a waiver provision within the statute. But in general, it's really that occupancy rate within that geographic area.
Further question, Representative Clouston.
Thank you, Madam Chair, and thank you, Director. Good to see you. Good to have you here. Can you give me any idea of what we're seeing in occupancy, number of beds in nursing homes for Wyoming? Is it going up? Is it steady?
Director Johansson.
Thank you, Madam Chairman. Representative Clouston, don't have the number of nursing home beds around the state in front of me. We can certainly get that. In the past several years, we did see bed occupancy drop, really influenced, we think, by the pandemic, which did affect nursing home occupancy in a couple of ways. One, we did see a lot of infection in the elderly and vulnerable populations, and unfortunately and frankly, death among that population. And so bed occupancy rate dropped for that factor. In addition, during the pandemic, there was somewhat of a reluctance or reticence nationally to go into facility-based care. So you saw more people staying at home, even if it might have been needed. So right now, over the past several years, we have seen bed occupancy in the nursing facilities in Wyoming drop. It's somewhat stabilized now. We'll get you the exact data, Representative Clouston. But when we looked at this, when it was on the Senate side a week or 2 ago, I think our current occupancy rate statewide, and again, heavily fluctuates community to community. Nursing home occupancy was around 74%, I believe. on average.
Additional questions for the director? Vice Chairman Ottman.
Thank you, Madam Chairman. Director Johansson, good morning. I was just wondering, when people apply for these, do all people that may want to build or construct, is it licensing? I mean, do they have to go through the Department of Health for licensing everyone? And also, does that include adult daycares and things like that? Thank you.
Director.
Madam Chairman, Representative Ottman, good question. So any provider that would want to provide nursing facility or nursing home services in Wyoming would need to be licensed by the state. That doesn't change with this bill. That licensure for many different types of healthcare providers is in statute for my department, my office, to license on the state side. That's a lot of different facilities, as you mentioned, hospitals, nursing homes, adult daycare facilities, ambulatory surgical centers, et cetera. So if an entity wanted to construct a new nursing home, in addition to these regulations, they would need to be licensed by the state of Wyoming Department of Health to operate. The second factor is most nursing homes also enroll and seek certification from the federal government through the Centers for Medicare and Medicaid Services to be able to serve and be reimbursed for Medicare and Medicaid clients or patients. We also, through my department in the same Office of Healthcare Licensing and Survey, we do that work on behalf of the federal government to do certification and survey for the federal components of that as well. So kind of a twofold answer to your question. It's yes on both accounts. But this would not, Representative Ottman, this would not, any facility that wants to provide nursing home services or wants to be a nursing home would not have to comply with licensure as a different provider type, as you mentioned, adult daycare facility, et cetera.
Further questions for the director? Representative Heft.
Thank you for coming, Mr. Director. Do we have some folks that are waiting in the wings to start projects right now?
Director.
Madam Chairman, Representative Heft, another really good question. I'm not aware of a facility that's made a request, but let me caveat, recently, but let me caveat that knowing that the certificate of need is on the books in Wyoming law, it's hard for me to tell you that a facility, a community, a company would not have made a request, but perhaps look at it and say, well, this wouldn't work in this area because of the statute that's on the books. That's certainly possible. So it's hard to give a definitive answer. I know since I've been with the department about 11 or 12 years, having seen a variety of different requests come through, some approved, some denied. As the sponsor of the bill mentioned very eloquently, it really varies by community. You do have nursing facilities that are more in demand, potentially more popular, that over recent history have not been able to expand because of this. And there's pros and cons to it. There's pros and cons to every policy decision like this. It's hard to look into a crystal ball and predict the future of, if this were repealed, would we see a ton of investment come into the state, new facilities being constructed? I don't know. Wyoming has some natural barriers to entry with our low population, difficulty in scale, high cost of labor, difficulty in accessing labor. So it's hard to say exactly what this would do in terms of new market entrants, but it has fluctuated over the years.
Thank you. Additional questions? A follow-up, Representative Heft?
Thank you, Madam Chairwoman. So if I heard you right, this would also allow for expansion of existing facilities?
Director.
Madam Chairman, Representative Heft, yes, right now expansion is allowed, but within those parameters in the statute. So not an unlimited expansion unless that occupancy rate regionally is less than 85%. If it's, greater than 85%, if the occupancy rate is less than 85% in that region, then those parameters within the current statute apply to no more than 10-bed expansion maximum or 10%.
Representative Wasserberger.
Thank you, Madam Chair. Thank you again, Director. Just another question to ask. What kind of folks what type of people are in the business of doing nursing homes? Is this like a lot of type of Medicaid, Medicare type of employers, or is there other types of entities that come in and do it or that have asked for some of these requests? Or could you elaborate a little bit on that?
Director.
Madam Chairman, Representative Wasserberger, happy to. 7:30 in the morning, you guys are asking some really good health economics questions. Generally speaking, as I mentioned before, nursing facilities, both in Wyoming and nationally, the biggest payers for those are Medicaid and Medicare. My department operates Wyoming Medicaid. We pay currently for about 65 to 70% of all nursing home bed days in Wyoming. So it's safe to say on Medicaid that we are the largest payer for these long-term care services. The second largest would be on the Medicare side. Medicare has pretty strict limitations on how much long-term care nursing home services it will pay for, generally speaking 100-day lifetime cap, and really focuses more on rehabilitation services. After a hospital stay, after a fall, folks that need to be have rehabilitation services. Where on the Medicaid side, where my department manages, is generally more long-term care, custodial care type stays. Then there's some private pay, long-term care insurance policies. It's an interesting market. I wouldn't say it's dominant in the payer mix. But yes, most facilities would accept some level of Medicare, and generally speaking, quite a bit of Medicaid, which we certainly appreciate.
Additional questions? Vice Chair Ottman.
Thank you, Madam Chair. Just one more. In section 3 here, it says on or before September 1st, 2029, the department shall report to the Joint Labor Health Social Services on the status of construction. So to me, that looks like, okay, if this goes into effect, or when it does, whatever, then there will be a report to say this has harmed or this has helped. Is that the way you see it? And does that create unforeseen nightmares or what?
Director.
Madam Chairman, Representative Ottman, there's no other place I like to be than in front of this committee reporting on the results of decisions that you've made. We have no problem complying with the reporting requirement here. I think as it was conceived last year when this was discussed, to look at 4 or 5 years in, what has this done? How can we evaluate the market dynamics? If there's been any harm, any access reductions or improvements, to report back to the committee, and we're certainly happy to do that. As I was mentioning to Representative Heft, it really is a difficult prediction to make of what would happen with this repeal. I would once again just note for the committee, there's pros and cons, risks and unknowns with any decision. Currently, there's about 35 or 36 states that have some sort of certificate of need law on the books. That doesn't necessarily just apply to long-term care or nursing homes, but as Representative Geringer rightly mentioned, since the federal government repealed the federal requirement for certificate of need in the late 80s, you have seen some states take those laws off the books for different provider types, including nursing facilities.
I have a question, Director, just to piggyback off the good Vice Chairman. So the way the bill's written, it would go in effect July 1st, 2026, with the reporting requirement in September of 2029. Do you feel the 3 years is adequate enough to produce a report of substance or not? Director.
Madam Chairman, thank you. Yes, it's difficult to say. As a very low population, low volume state, how much statistical power would be behind that with the unknowns of what would have happened with market entrance, investment in these types of facilities. It's difficult to say, would you have a robust study showing, definitively and quantifying the effects of the repeal or not? Not sure you would get that, but we would have no issue giving a extremely high quality and substantive report to the legislature on what we had seen and what we can correlate with the with the statutory repeal.
And just a quick follow-up, Director. In that section 3, it doesn't specify whether or not the report will be in person or through written. Do you have a preference or feel the need for cleanup in that area?
Madam Chairman, we'll do both anyways. We like to give you what we think is objective and quality analysis. But I would just assume, even before the reporting date, should the committee or should we believe we have information to share on that through the interim or during the session, we would certainly reach out to schedule that.
Thank you, Director. Further questions? We had quite a few for you this morning. All right, we'll move on to public comment on House Bill 289. We've got 3 chairs up here, so don't be shy. Okay, good morning. Please state your name and we'll hear your take on the bill.
Good morning, Madam Chair, members of the committee. My name's Jeff Daugherty. I'm here representing Cicero Action today. Madam Chair, I will keep my comments to under 2 minutes, but I want to let the committee know that to my knowledge, I'm one of 2 people in this room who have a degree in philosophy, and that has yielded us dozens of dollars in lifetime earnings. But I was thinking about it this morning, and there's actually an applicability. One of the ways that logicians test the merit of an argument is to change the variable. In this case, before you, we're asking healthcare providers to determine whether or not there's sufficient room in the market for other healthcare providers to enter. If you change the variable and say, I want to open a Burger King, let me check with McDonald's and see if they're selling a sufficient number of hamburgers to allow me to enter the market, it demonstrates the awkwardness of the argument. And the reason it seems awkward is because it is awkward and it is not consistent with free market ideals and trying to I guess I would say that competition breeds excellence, members of the committee. And so for too long, we have been subject to arbitrary bed restrictions that have stifled innovation in this space. I would tell you that competition breeds excellence, that by passing this, you are going to provide better and more healthcare facilities for people who are in need of that. Having been through that journey with both my parents recently, I will tell you, you need different kinds of facilities through that aging process, not just one. And I would also tell you, it is vital to have facilities close to family, because there's nothing sadder than people who are alone and lonely going through that process because family can't be close enough to them. I would also tell you that Wyoming is in a great position nationally in terms of con repeal, and this would put us at the forefront of that nationally. So, Madam Chair, I'm going to try to keep my comments brief, and I would just urge you to support this because I think it strikes the right balance between responsible regulation and healthcare flexibility.
Thank you, Mr. Daugherty. Committee, any questions? Representative Yin.
Madam Chairman, thank you, Mr. Daugherty. Appreciate it. So, with burgers, there's a lot of demand for burgers. People like eating burgers. With nursing homes in a population as low as ours, the demand is not as high. And I understand that the cons of a certificate of need, but I'm curious on whether. So your belief is that it would not increase healthcare costs for nursing homes if there were 2 in a place where there wasn't enough demand for even filling one?
Mr. Daugherty.
Representative Yin, great question, and I agree that there are differences between nursing homes and hamburgers. But I would tell you that I think that the number one thing this does is provide options for people, and our community needs options in this space. I think there is demand, especially in some of our more rural communities. Those won't be expansive centers, but we need options for those those folks in those communities. So great question, Representative Yin.
Any additional questions for Mr. Daugherty? Representative Wasserberger.
Thank you, Madam Chair. Thank you, Mr. Daughtertree, for coming and testifying today. I guess to kind of follow up on rural communities and things like that, do you know if there's folks that would like to do you know other places or other states where they opened up nursing homes in rural areas, or places here in Wyoming where they would like to do that, but there's been a limitation?
Mr. Daugherty.
Madam Chair, Representative Wasserberger, the journey that I went on through my family's from the western part of the state, but we went through that process with my father down in Utah, and it was a struggle because as he went, there were facilities, but there wasn't room in the facilities. And so the problem is that they start off with an assisted living, and then as their aging process occurs, they need different things. And it's difficult to find spaces, and we were getting notice from one facility that my parents needed to be moved, and there were no other vacancies in the other facilities to be able to accommodate those needs. And so we were having to do some magical things to keep my parents in a safe place until we could find space in the sorts of facilities that could accommodate their needs. Does that answer your question, Representative?
Additional questions from the committee? Okay, seeing none, thank you, sir, for your testimony. Good morning. Please state your name and who you're with, and we'll hear your testimony.
Thank you, Madam Chairman. My name is Tyler Lindholm. I'm the State Director for Americans for Prosperity here in the state of Wyoming. We're on and in favor of this piece of legislation. And if I could, Madam Chairman, I'll just answer some of the questions I had heard specific to my knowledge. When it comes to who is specifically affected here in the state of Wyoming, I'm sorry Senator Crum couldn't be here. He's passionate about this issue because this happened in Laramie, where they were trying to build a new facility. In fact, Madam Chairman, and to the rest of the committee, you heard the Department of Health talk about how there was recently 18 different applicants over a period of time. 11 of those were approved, 7 were denied. That means 7 communities were denied building a new facility. That's 7 facilities that provide jobs. That's 7 facilities that provide places where our loved ones can go because of an arbitrary law that the state of Wyoming was coerced into in 1974, right along with the rest of the nation. States were pushed into this situation by the federal government that said, if you don't put these in, we're going to withhold funds. That's what the federal government does, Madam Chairman, as you well know. And by 1987, the federal government had said, well, this didn't work. This was a horrible idea. And they repealed their own laws. And since then, Madam Chairman, since President Ronald Reagan, every presidential administration has asked states to repeal their con laws. This is the last piece that the state of Wyoming has on the books. This is it. And Wyoming will have repealed all the way to our now current administration with President Trump and his prior administration in 2018. His administration had asked states to repeal their certificate of need laws. Now, Madam Chairman, as you well know, because you were on this committee when it was sponsored, the last go around to repeal certificate of need. Certificate of need touches multiple different types of facilities in a lot of different states. Thankfully in Wyoming, it's just nursing homes, so we can get rid of that. With the increase in costs, I heard that question, Madam Chairman. Does this increase costs? What we've actually seen in our studies is that Medicare and Medicaid spending per nursing home enrollee is higher in certificate of need states versus non-certificate of need states. There's also some data that shows that total Medicare costs are higher in states that have certificate of need requirements for nursing homes specifically and home health agencies than in states that have repealed the law. Correlation is certainly not always causation, but just random bureaucracy for the sake of bureaucracy does seem to stifle competition and does seem to raise costs. So for that reason, Madam Chairman and members of the committee, we ask that you vote aye on House Bill 289.
Thank you. Committee, any questions of Mr. Lindholm? Okay. Seeing none, thank you for joining us this morning. Further public comment, registered lobbyists. Good morning. Morning. ma'am. Please state your name and we'll hear your take on the bill.
Good morning. Is it on? It's on. Okay. Good morning. My name is Leah Lowe. I'm our Regional Vice President with Empress Healthcare in Wyoming. We own 6 skilled nursing centers in Laramie, Natrona, Carbon, Hot Springs, Fremont, and Sweetwater County. Our skilled nursing facilities make up about 21% or 623 beds of the 2,915 beds in our state of Wyoming. Of the 36 skilled nursing homes in the state, the current total bed occupancy is an average of 67%, which is currently well below the 85% occupancy threshold. Centers are barely making ends meet with the current funding and regulatory requirements. One question that was presented on January 22nd during the previous bill was why are SNFs, skilled nursing facilities, not at occupancy? To be honest, we have not fully recovered from the COVID pandemic. We've seen an increase in home health and private duty companies where more and more people are staying home longer. We see people coming to us with higher acuities than pre-COVID times, increasing our use of resources and cost with minimal reimbursement. We are also recipients of the trickle effect of when hospitals open swing beds. To survive, they use 20 days of Medicare Part A, which would have been days applied at the nursing home. We are also affected by timely Medicaid reimbursement. We house approximately 80% of Medicaid recipients. When the state is affected by a workforce shortage, we feel the direct impact as Medicaid approvals are delayed often by weeks, and if not months, limiting the amount of Medicaid a center will accept. The implications of a quick certificate of need repeal would be grave to nursing homes in our state at this moment. A few questions we need to honestly ask ourselves. Do we have the financial capacity to support centers who would be experiencing closure? Do we have enough community resources across the state to support our SNFs, the highly most regulated industry? For instance, the need for psych services. More and more referrals to nursing homes are people with behaviors and psych diagnoses. SNFs struggle to meet the basic needs of psych residents and could be faced with severe penalties in the event the person is discharged, often due to lack of community resources. Do we have enough workforce? CNAs, medication aides, LPNs, RNs, physicians, in the healthcare industry as a whole. Many centers pay temporary workers to fill shifts. Increasing cost, causing inflation, and diluting the opportunity for quality of care, which also reduces our opportunity for center physical plant improvements to keep up with the ever-changing public demand. In my last testimony, I spoke of an experience of where the costs associated with non-loyal travel staff make up about 40%, and how many centers across the state are taking resources from one area to allocate them to another to offset the costs in the current labor shortage. In closing, a quick repeal without a sustainable plan in our current natural market population would be gravely damaging to SNFs across the state, especially in our rural communities. Many states have adopted different reform options to alleviate the negative consequences of SNF closure. At any rate, the majority of the nursing homes in Wyoming are older buildings and would require an increase in Medicaid reimbursement to be sustainable. Thank you so much.
Thank you.
You're welcome.
Any questions from the committee? Okay, seeing none, thank you for your testimony. Sir, please state your name and we'll hear your testimony.
Madam Chairman, committee members, Eric Boley with the Wyoming Hospital Association and Leading Age Wyoming. And maybe before I testify, I do have a member that's online. If you want the paid lobbyist to go last, I have one of my members, Eric Connell, that's online that wants to testify.
Okay. Co-presenter online, come on in.
Good morning.
Good
Can you hear me
morning.
okay?
Yep. Would you like to defer to him first? Okay. Please state your testimony, Mr. Connell.
Yes, thank you. My name is Eric Connell. I'm the CEO at North Bighorn Hospital District. We're in Lovell, Wyoming, in the Bighorn Basin. I'm also the nursing home administrator for our attached nursing home, New Horizons Care Center. I'm also the board president of Leading Age Wyoming, so representing the primarily not-for-profit side of nursing homes in the state. I appreciate the committee hearing my testimony today. I've been very patient. I'm passionate enough about this topic. I actually I was gonna play hooky on Wednesday and go to Antelope Butte and go skiing with my 3 oldest kids. I decided to hang out with you all, and I gained a further appreciation for the dedication that you have to spend all day sitting in meetings and into the evening and ordering supper into the chamber, and so that you can do your business, and appreciate that you do that on behalf of the state. We have a lot more in common with those that are in favor of this bill than not. I will tell you, I was just thinking 10 years ago, I was in graduate school, my first semester at the University of Utah. Having been born in Wyoming, raised mostly in Montana, and then in Utah, discussing certificate of need and the impacts of that. And I can tell you, having been listening to Glenn Beck on the radio before he was big like he is today, when I heard this idea about we were going to limit competition in healthcare by having the state determine how many hospital beds or nursing home beds we can have, I rolled my eyes in the back of my head and I said, that's the most ridiculous thing that I've ever heard of. So it's taken me 10 years to come to a position now, and I'm limited in expressing to you all of the ways that has changed over the years. But let me hit a few points, and I will try to be brief, but I can be a little bit wordy. So the first is this idea that the law is arbitrary and that we were somehow forced by the federal government to enact certificate of need. No one likes that idea, but it's a fact of life. We deal with that. And the reality of being able to just say, hey, we're not going to deal with the federal government, it's not feasible. I will tell you, we love competition. We bought a surgical robot at my hospital about a year ago. Our neighbors to the west, 2 hospitals to the west, bought one. They announced their purchase about 2 weeks after we did. And I love to compete, but I will tell you, in my heart, do we need $2 million surgical robots 45 miles apart in rural Wyoming? Is that increasing the quality of care? No, it's competition. But what we actually are doing, we're not driving down costs by competing, by putting in new surgical robots or building new nursing homes, assuming that there's the capital that wants to come into the state, but that's another discussion. But it's not so simple. It's not so cut and dry. I agree with the idea, burgers are burgers. They're not healthcare. I want to educate the board on one piece, or excuse me, the committee on one piece, and that is the difference between custodial care and rehabilitation. Because I can tell you, and you could study and look at other states that have more relaxed laws related to certificate of need. Capital will flow, right? If we let the free market dictate all of the parameters, the capital will flow to the highest margin services, okay? Those are rehabilitative. Those are the Medicare services that the federal government primarily is responsible to pay for. Rehabilitative, post-acute care, swing bed, those are some of the synonyms for that type of care. Custodial care was mentioned by the representative from the Department of Health. Custodial care is also indigent care. So when someone needs a nursing home because they have dementia, because their activities of daily living have reached a point where they can no longer care for themselves, those typically, the highest concentration of those are being paid for by the state of Wyoming. And those residents typically, right, when Medicaid pays for that service, those patients are now on the dole. Those residents are now on the dole. They're on Medicaid. If they have assets, they forego those assets. They're allowed to keep very, very little. And Those are the residents that are at greatest risk if you repeal certificate of need. Capital will fly to the high margin services, the rehabilitative services. It will be very difficult, if not impossible, to find somebody that's interested in coming in and providing low margin care. I can tell you this because we subsidize Medicaid. We subsidize those nursing home residents on Medicaid, which is the vast majority in a rural place like Lovell. We do that because it's a mission-driven project. We do that because we're investing in the community. We do that at the goodwill and pleasure of our community, which provides mill levy support for our nursing home. So when we have the opportunity to provide that rehabilitative, that swing care in our facility, in our organization, that higher margin service is vitally important to keeping our doors open. And so that's why this is important to me and to our organization, and I know to many others. The biggest barrier to growing nursing homes for those communities in our state that are different than Lovell, where there may be some more competition, would be helpful. And you would see capital, flying into that community to build, beautiful new nursing homes. Those are a different case than our rural communities. So I would urge caution to the committee in moving quickly on this. I'm sensitive to the fact that residents and patients want to be close to home. They want to be in a nice facility. And I believe there are other alternative options that can achieve that. We could look, it was mentioned, Utah was mentioned, that it was so difficult to navigate that system and find placement for a loved one. Utah does not have certificate of need. So the idea that you're going to repeal wholesale this nursing home portion of certificate of need, and that all of a sudden nursing homes are going to be built all over the place and it's going to be easier to get mom and dad into a nursing home, I think that's a little short-sighted, if I'm being honest.
Ms.
So
McConnell, I'm just going to ask you to bring it home.
So with that, I'd urge a little bit of patience here. I think there are some ideas to put quality measures in. You are going to penalize the most vulnerable members of our community. You're going to create more risk for the rural hospitals. And so please consider tabling this bill, or consider reasonable amendments that can achieve the underlying design here, and go forward. Those are my comments. Thank you for being patient.
Thank you, Mr. Connell. Committee, any questions for Mr. Boley or Mr. Connell?
Madam Chairman, I did have some comments, if that's all right.
Okay, if you can keep them succinct. I thought he was co-presenting on your behalf.
He was, I'm sorry, Madam Chairman, he was public wanting to present.
Gotcha.
I provided y'all a handout 2 days ago. Hopefully you spent time reading this while you were deliberating all those bills on the floor the last couple of nights. But what you see is this from Washington, Leading Age Washington, and I thought it'd be easier to use their study than doing one of my own. There are 36 states that have some form of certificate of need. There are a lot of great ideas in here. It talks about the pros and cons of certificate of need. I won't rehash those. But what I will do is I'll tell you that there are some problems with this. The reason this bill came forward this time, and that we were able to defeat this in the Senate a couple of weeks ago, Senator Crum is concerned about the nursing home in his community. There is no one that wants to build and has asked to build in Laramie, but he's concerned. And so he brought this bill forward this time. We brought it as an interim topic 2 years ago, and this committee spent very little time looking into the certificate of need. I think we spent almost 15 whole minutes on it before there was a decision to repeal certificate of need. The reason that I brought this forward is because Representative Geringer did a great job of identifying a few of the flaws in the existing certificate of need, especially for existing nursing homes. And what we wanted to do is have a look at those requirements for expanding beds in existing nursing homes, whether or not the 85% occupancy made sense or not. And we actually had some lost opportunities during the pandemic because of ARPA and CARES funding, where If this hadn't been in place, we may have been able to put private beds instead of semi-private beds in our nursing homes around the state, maybe have been able to expand their footprint using those federal funds to prepare for what's coming in the future. And so we wanted to take a really close look at this. The reason that Senator Crum is so upset is he keeps going back to quality. Well, I will tell you, if you repeal certificate of need, which is the easy way to do it, and you can do it anytime you want, the votes are there, it's not going to drive quality. There is no proof that it's going to drive quality. So my suggestion is, if we want to drive quality, let's do that by using certificate of need. I've suggested a few ideas where we could take a look at occupancy rates. We can take a look at whether 2 beds is enough or 10%. But why not use certificate of need, which is somewhat what other states do, and use quality measures to drive quality? And I think we could do that if we spent some time. And that was what we were basically commissioned to do in the Senate, was to take the next year and come back with solutions. And we were commissioned to do it on our own because the committee hasn't done it in the last 2 years. And so we're happy to do that. Senator Crum, I think, would be a part of that. I don't see any huge push right now for this. And I will tell you that I usually get a lot of calls, people interested in entering the state in long-term care. Most of them don't want to build here. Most of them are looking at acquiring an existing facility. And there are barriers that have nothing to do with certificate of need. We don't pay enough here, and 70% of our market is Medicaid. We don't even cover the costs of providing enough money to cover the care of our Medicaid patients. What we have seen in other states, though, when this happens, and Utah's a great example, when they lifted their certificate of need, there were a whole bunch of skilled nursing facilities, small ones, that took the Medicare patients and left the Medicaid and the Medicaid patients to their community facilities. And what happened is you ended up with a 2-tiered system where they were taking the high reimbursement and leaving the others for your community facilities. We've seen 12 nursing homes close in Montana in the last recent years. We've had 2 in Wyoming that have closed. We have others that are considering closing. And it's not because we don't have demand. There are patients out there, but we don't have the staff. And what this is going to do is it's going to fracture that even further. An example that I'll use, and I know Director Johansson hates this one, but Buffalo, the VA came in and federally funded a nursing home in Buffalo. And we fought that because they did not have to comply with certificate of need. So they built a beautiful nursing home up there. Buffalo, Johnson County Nursing Home has a beautiful 45-bed nursing home that overlooks the golf course and looks up into the Bighorns. And what happened is there's not enough staff for either of those 2 facilities up there. So right now, that community-owned and community-funded one, only 2 of the 3 wings are open, and it's because there's not enough staff up there. And we're seeing that all across the state. This isn't going to fix that. This is going to create situations where the bright new shiny object comes in. They might siphon away some of the staff, and then what you have is 2 facilities that are struggling in a community. And what happened is we actually had 2 of our nursing homes that went bankrupt. And you guys probably don't know this, the state had to step in and take over operations of both of those nursing homes. One was in Saratoga, one was in Rock Springs. So what could potentially happen here is we continue to grow, we let them come in, we build these new bright shiny objects. You may end up with more of situations where the state has to step in and staff those and take care of them until they can find a buyer. The one in Saratoga never really reopened as a nursing home. It's now part of the critical access hospital, and that's one of the things that'll be removed if we repeal certificate of need. One of the things in here that takes care of our small critical access hospitals that really rely on and only stay solvent because they can take care of swing bed patients. Swing bed patients are a skilled nursing patient that is paid for by Medicare, and our critical access hospitals rely on those to stay solvent. And then, like Mr. Connell talked about, then they have a nursing home attached that takes them as Medicaid or private pay. The private pay only lasts a certain amount of time, and then they spend down everything they have, and then they go onto the Medicaid ranks. And so what I would ask is, instead of repealing this right now, I'd ask you for a year. I'd ask you for the opportunity that the Senate gave us. Give us a year to work on solutions that drive quality, And if you don't like what we come up with in a year, let's repeal it. But give us a year to work on this as an industry with the legislature and come up with something that actually drives quality, which is the reason this bill was brought this time. And with that, I would answer any questions. Thank you, Madam
Any
Chairman.
questions from the committee for Mr. Boley? Representative Clouston.
Thank you, Madam Chair. Thank you, Mr. Boley. Can you review for the committee how the Medicaid reimbursement works for the skilled nursing facilities? So federal pay, state pay, and how those rates are set.
Mr. Boley, the Cliff Note version, please.
Madam Chairman, I'll do my best. So a patient that needs to be admitted to the nursing home has to go through two different tests, PASSAR and LT 101, that are administered by the Department of Health or Public Health. Once it's determined that they are appropriately suited to go into long-term care, we are reimbursed by Medicaid. Medicaid is a 50-50. We're an FMAP. Our FMAP, federal matching, is 50-50. We're one of the lowest. So 50% of the payment comes from state funds, 50% comes from federal funds. Each year, we submit a cost report that shows what our costs are, and our rates are adjusted. There are a few intricacies in what the rates are, and it has to do with acuity and some other levels of care. Right now, I think we receive about $290 per day. Our costs are somewhere around $320 to $330 per day.
Further questions? Follow-up, Representative Clouston.
Thank you, Madam Chair. Thank you, Mr. Boley. So if it's $290 a day, is the state of Wyoming setting that? I guess what I'm saying is if we said we're going to increase our budget for Medicaid nursing homes, the state's going to pay an extra $20 a day. Would the feds match that $20 a day?
Madam Chairman, Representative Clausen, yes. And actually,
Mr. Boley.
last year, thank you, Madam Chairman, last year, the governor did put in an increase. We'd gone 10 years with our rates, either frozen or decreased. Last year, we did get a 20% bump that brought us closer to cost coverage, but is still far below what the actual cost is. And yes, it'd be a 50-50 match.
Further questions? Okay, I have one.
Sure.
Yep. So you talked a lot about what the committee's done or tried to do in the past on solutions for this and so forth. And it almost sounds like there's been at least 2 or 3 years that this topic's been brought up. Just curious if what attempts have been made now outside of committee. I mean, I don't see a bill that's come forward to work with the existing structure, and you're asking for a year.
Madam Chairman, it's a great question. So to change this, we need a statutory change. And so we had brought it as an interim topic. In the first year, the solution was to repeal it, not to work on the existing statute. This last year, we didn't actually know it was coming back. We've been talking about ideas and hoping it would come back, but it wasn't assigned as a management council committee topic. We have been meeting and we have some ideas, but we didn't have a vehicle to do that. With the direction of the Senate and with your direction, we'd be happy to bring forth a bill addressing this for the next session.
And I do have a follow-up question. So you spoke a lot about the workforce dilemma with shortage of staff, CNAs and so forth. Obviously, you know, that's a skilled profession. Community colleges are working hard on that. There's high schools that are partnering with local hospitals to get our young adults more invested in the industry. I'm just curious if the Hospital Association has ever lobbied for an expansion of the Hathaway Scholarship to expand to trade schools.
Madam Chairman, we haven't lobbied for expansion of Hathaway. We've worked closely with community colleges and with the college to expand slots. We've actually worked with the local community college. They're doing an LPN program now, which is the only one in the state, which LPNs are very important, but we haven't specifically lobbied on Hathaway.
Thank you. Mr. Boley? Further, Representative Clouston.
Thank you, Madam Chair. Thank you, Mr. Bully. I'm just trying to think, we have different stages of life, different stages of care. Somebody may go into a nursing home that needs some assistance, but not a lot. And then we have our patients that are, need constant care. So how do the beds work? And I guess what I'm trying to do is, if I have a smaller community that maybe wants to put in a facility that maybe the residents don't need as much care, and they're close to a community that has a large facility, so this is kind of blocking them. Is there a way that the smaller community, looking at occupancy, 30-mile range right now, could they put in a facility that gives gives care, but it's not that high-level care? And how does this current law prohibit them from doing that?
Mr. Bully.
Madam Chairman, Representative Clouston, so this bill is specific to long-term care. So assisted living isn't encapsulated in this. There's nothing to preclude assisted living from being built in those communities or adult daycare. It's very specific to long-term care and nursing homes.
Additional questions? Okay, seeing none, thank you, Mr. Bully.
Thank you, Chairman.
Ma'am, thank you for your patience. Please state your name and who you're with, and we'll hear your testimony on the bill.
Madam Chair and Committee, my name is Carolyn Passano. I'm with the Wyoming Healthcare Association, which is long-term care. And also all of those facilities take in persons who need short-term care and rehabilitation. I was one of those people a few years ago after a car accident. And by the way, it was here in town and I had very good care. I have another idea. And I have been involved with certificate of care since I sat in your chair, Madam Chair, so many years ago. And we have never really moved in this direction to help ourselves. I'm getting over a cold. It's time to bring in our congressional delegation. The time in where we are works this time. We might have a door we haven't had before. The last person who came from a foreign country and was well-trained to work in a nursing home left probably about 9 years ago. And it's time to open that door again. We need workforce. We don't have it. And yes, our long-term care nursing homes are very much in need. We have a paucity of population in this state. Maybe we will never get enough of our own going to college to become a registered nurse, an LPN. We actually have to reach out and look at another country, the Philippines, as an example. They're well-trained people. They actually bring families that are LPNs, CNAs. They bring some family that can be a CNA. It's been very good working, and we have not had a federal government that was open and willing to bring others in for quite some time. The door might be open this time, and we should try to take advantage of it. Again, I would ask for that year. Let's see what we can do. Our congressional delegation, especially Senator Barrasso, being second in the Senate, really has an opportunity to do something for us and will, as a physician. All three of them are very knowledgeable and are doing such good work in Washington. They're going to be helpful to us. And we have an administration that perhaps will help too. It's time that we figured out what Medicare and Medicaid are really going to do. And we need to talk so openly about the fact that the federal government is running nursing homes in Wyoming. I don't know if any of you have counted how many of the mandates that we have. It's over 200 from the federal government. If we want to have the best, and we do, it's time that we looked at that whole picture and what the federal government itself is doing to us in running us when we could do better if we didn't have the federal government in charge. I don't know how many of you have looked at what survey is all about and who writes those mandates. Wyoming didn't write them. The federal government did. I don't need to go on, and I apologize for taking up this much time, asking for another year to work on this and to get our congressional delegation involved. I'm positive they will. Thank you.
Thank you, ma'am. Any questions of Ms. Passano from the committee? Okay, seeing none, thank you for your testimony. Any further public comment? Anybody online? Okay. Public comment?
Curious if I can bring somebody back up for a question.
Sure.
Previous speaker.
Yep, so Mr. Daugherty, please come back up. One of our committee members would like to ask you a question they forgot during your last public testimony. Representative Wasserberger.
Thank you, Madam Chair. So our previous speaker made a really good point about maybe opening it up to allowing for some international practitioners to be able to come into the state. Like talking about having them come from maybe the Philippines or elsewhere. And I know you're working on another bill and with someone else that kind of would relate to helping with that. Do you know where the success along the roads with that bill is coming? And the reason I'm asking is because with this bill here, I know we had another person concerned asking for us to give them another year. And so I'm just thinking as far as workforce, things like that, I would think that would be perfectly okay to allow for some of that to happen because I know we have a shortage of it here, but I'm just wondering, do you know if that's coming along pretty healthy on the Senate side?
Mr. Daugherty.
Madam Chair, Representative Wasserberger, so great questions. The bill that you're referring to seeks to solve a problem in Wyoming. We do struggle for healthcare providers across all sectors within the state of Wyoming. And so the bill that the representative is referring to makes it easier for foreign doctors to be able to practice in Wyoming. And Representative Wasserberger, the bill still is in play over in the Senate right now, and I'm optimistic for the chances. But to your second point, one of the reasons it's so tough, I don't know if you've watched what CNAs are asked to do in these jobs. It's a lot. Those people are owed a debt of gratitude for the really difficult work they take on. When you look at what we're compensating those people, I would say it's a labor of love, more than an ability to earn an income. It is very difficult to support a family. And perhaps Representative Wasserberger, that might be something our healthcare providers could be looking at, is whether or not we're properly compensating those people. But Madam Chair, I think you raised a very important point in your question, in that we've had years to look at this. And Madam Chair, I think competition breeds excellence. It will save cost and it will help our consumers. And I would argue that it would not be inconceivable to think that these very arguments were made in 1990, right in this building, when we were talking about repealing con reform or con for hospitals. And I'm not surprised, and I'm not faulting the people who make those arguments. So Madam Chair, thank you for the opportunity to respond to the representative's question.
Thank you, Mr. Daugherty. Okay. I am going to close public comment on House Bill 289. Committee, what is your pleasure?
Madam Chair.
Okay, the bill has been moved by Representative Gugamas. Second by Representative McCann. Discussion amendments. Representative Wasserberger.
Thank you, Madam Chair. I was just thinking, I know there's, from some of the public testimony we had, one of the folks testifying just asked us to give them an extra year. So I was thinking, I'd like to just make an amendment that we make the effective date July 1st, 2027 instead of 2026.
Okay, there's a motion on the table by Representative Wasserberger. Mr. Caldwell, do you have that? Okay, perfect. Is there a second?
Second.
Second by Representative Yin. Committee discussion on Representative Wasserberger's amendment. Okay,
Madam Chair.
Representative Yin.
Yeah, Madam Chairman, I'm soft in the bill, but I do think that putting a year gives a fire under them, right? So if we don't do anything about it, it'll be repealed. It'll be repealed. So they will definitely have to come to us with a solution in a year if we make it effective 2027.
Further discussion on the amendment. Representative McCann.
Thank you, Madam Chair. This is obviously not a new problem. They've had plenty of time to think about this. It's not something that's come up all of a sudden. You would think that they would be striving for quality all the time instead of just when some emergency pops up.
Further discussion on the amendment? Okay, seeing Representative Wasserberger, sponsor of the amendment.
Thank you, Madam Chair, and I certainly agree with what you have to say over there, Representative McCann. I don't think you're wrong about that at all. My thoughts on this is just, if we can do this and have it be successfully done, and then we've got people not fighting to lobby us as hard on it as maybe if we did a year earlier. That's kind of my thought, is maybe it's just gonna make that tension on the lobbying a little bit lighter if we give them that extra year. So I don't disagree with what you have to say, though.
Further discussion on the amendment? Okay, seeing none, sensing the urge to vote, by a show of hands and a voice vote, all those in favor of Representative Wasserberger's amendment, state aye. Aye. All opposed?
No.
Okay. So that's 3 noes and 2, 3, 4, 5. Five ayes, 3 noes is what I heard. Is that correct?
We should call for hands.
Okay, let's do it again. Sorry. All those in favor of Representative Wasserberger's amendment, please leave your hand up and by a voice vote, say aye.
Aye.
Okay, so that's 3 ayes. All those opposed?
No.
2, 3, 4, 5. Okay, so the amendment has failed. Additional amendments, discussion. Representative Clouston, we're back on the bill.
Thank you, Madam Chair, and thank you, committee. I guess one of the things I was trying to get to is I think one of the problems with this whole situation is what we're paying to help take care of these folks, right? Like, we're giving these facilities less than what their costs are, which is a problem. And I understand, we there's always budgetary constraints, but this is a population that needs help. We're going to spend $20 to $30 million on a shooting facility, which probably isn't a need, but this is a need. So, and what I was trying to get to is, if the state of Wyoming says we're going to pay an extra $20 a day per resident, right? The feds are going to match that. And I think by probably increasing what we're paying for this population, that we're going to see better care, we're going to see more people involved in building nursing homes, and I think we'll see more healthcare providers wanting to go into that. So just something for this, I mean, that's not part of this bill right now, but I think it's something that I'll probably suggest and bring forward later to this committee, is that we probably need to look at what we're spending on this population.
Additional discussion, Representative McCann.
I have a personal note with this. My grandmother was placed in one of these facilities, actually hospital run. She actually had decent money, and her medicine bill alone was $30,000 a month. I mean, she paid practically for everybody's meds on that floor. So I think competition is needed as opposed to a monopoly. Thank you.
Additional discussion on the bill, Representative Yin.
Madam Chairman, thank you. So I was in interim committee when we had this bill, voted against the sponsorship, but I did vote after it was sponsored by the committee to bring it to the floor. So I'll do the same today, but I don't think this is going to reduce costs. I think it's going to increase costs. So I will likely be voting against it on the floor.
Additional discussion on the bill. Vice Chair Ottman.
Thank you, Madam Chair. Great discussion, important topic, and I will say it's good to hear lots of people wanting to come to the table. But 5 years ago, it was the same testimony, same people, and nothing's changed. So that's kind of what I'm looking at. And you can disagree, but I remember those conversations. And it was difficult, and it is difficult, but something's got to change. And I know a lot of it is about reimbursement and, of course, money, but that doesn't seem like that's going to change in this world. So we've got to do something.
Further discussion on the bill, Representative Heft.
Thank you, Madam Chairwoman. In my world, competition has always been a healthy thing. People work harder for resolutions when things get tough and when decisions are hard to make. My thought is that if we move this bill, that all the people that we've heard today will work a little bit harder to make this better.
Question being called by Representative Yin on House Bill 289. Mr. Caldwell, if you would call the roll.
This is a roll call vote for House Bill 289. Representative Clouston.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft. Representative McCann.
Aye.
Representative Ottman.
Aye.
Representative Stivar. Representative Wasserberger.
Aye.
Representative Yin.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 8 aye and 1 excused.
Okay, committee, House Bill 289 has passed committee. Representative Geringer, you would present that bill on the floor. Okay, all right, committee. We have one bill that was on the agenda that was left, House Bill 128, that we are not going to get to, unfortunately. We gavel in at 9 a.m. this morning. And today is last day of bills out of committee. So I just want to thank the committee members for their good work this morning. Thank you for being here early. To the public, thank you for joining us early. And with that, the meeting will adjourn.